Scabies is a highly contagious skin infestation caused by the parasitic mite called Sarcoptes scabii. It is caused by direct contact with the mite through skin-to-skin contact, and the mite leaves linear burrowing lines behind as it burrows into the skin. Risk factors, of course, are living with somebody with scabies, sexual contact with multiple partners, and overcrowding. It typically peaks in the colder seasons, as people are more likely to stay indoors together. Places like hospitals, nursing homes, prisons, or schools can also be a nice place to spread. A patient may complain of pruritus, especially at night, simply down to the fact that they're not distracted as they are in the daytime. Classical places where they are found is in the interdigital web spaces of the hands, palms, soles of the feet, wrists, axillae, male genitalia, or around the nipples and umbilicus. The rash presents as linear lesions, papules, and nodules, and they will most likely have excoriations from scratching and have an eczematous rash from a hypersensitivity reaction from the mite allergens. Usually a high clinical suspicion is good enough to start treatment. However, you can confirm a diagnosis of scabies by microscopy of the skin scrapings from papules or burrows, which may show mites, their eggs, or fecal matter. This is then dipped in liquid paraffin. Complications of scabies can be impetigo, such as from staphylococcal or streptococcal bacteria. The itchiness and scabies may also persist for up to 4 to 6 weeks after treatment. The usual treatment for scabies is a 5% preparation of permethrin cream all over the body, then wash off after 8 to 12 hours. If any of this is cleaned off, such as after washing your hands, they have to reapply the cream. If a patient cannot tolerate this therapy or are unlikely to comply, you may give them oral ivermectin, which has similar cure rates. You cannot use this in pregnancy, however. If they can't tolerate or have an allergy to permethrin or ivermectin, they may be given topical malathion, but you wash this off after 24 hours and is only applied once weekly for 2 doses. However, treatment doesn't stop there. You have to prevent further spread, so all household members must also be treated, even if they're asymptomatic. And then the day after the first treatment, recently worn clothing and bedding should be washed at 60 degrees Celsius or more. You should then follow up the patient 1 month later to see how things went. Thank you for watching the video, and don't forget you can always find out more about guidelines about scabies through NICE guidelines. And this is only an educational video and should not be used as clinical guidelines.